Welcome back to Good Day Sinlaw. Joining us is Tracie Givens, who's a nurse practitioner at Chris's Cabrini Hospital. Today she's going to be discussing with us diabetes and how to manage it. Thank you so much, Tracie, for being with us.
Thank you.
So let's jump right into the conversation. Diabetes, obviously, we break it down into two types immediately, and so let's get right into the information that our viewers need to know about it.
Okay, so diabetes can be broken down into type 1 diabetes, which usually we find that in children, teenagers, young adults. That's where the body does not produce the insulin. Now, type 2 diabetes is different. That is what most of your middle-aged adults or your older adults will find in those patients, and that's where your body doesn't use the insulin properly.
Can you tell us a little bit how can we learn the onset of diabetes? Are there any signs or symptoms that we should be looking for and clues?
Absolutely. With a lot of patients, they come in because either they're having increased thirst or they are going to the bathroom more often, having increased urination.
Really? Okay.
Sometimes they are having some shakiness or getting dizzy. Vision changes can happen pretty often. There's several signs and symptoms, and usually one or more than one of those will bring patients in to say, I'm not sure what's going on, but I need to find out.
So when you have that, that's when you need to call the doctor and come in for a checkup.
Absolutely.
To see what's going on.
We can run some blood tests, some lab tests that we can do either in the office as a quick test, basically, where we could do a finger stick and we could have an answer within about 5 minutes.
Wow.
Or we could run some more in-depth blood work that would take several minutes.
Okay.
We're seeing some footage there on the screen right now of a test from one of the testing operations there. And then at the same time, let's get more into detail with type 2 as we see it later on in life. Are there some preventative measures we can do with diet and things like that to help as well?
You know, diabetes overall is thought of as the sugar disease, but it's not always sugar. Sugar definitely plays a part into it, but it's also carbohydrates. So your whites, your white rice, your white potatoes, your white bread, your pastas, the good Louisiana foods there.
Yikes.
But diabetes is not about what you can't have, it's more about what you can have in moderation. So we encourage patients to watch their diet, especially if we are not fully diabetic, just on that borderline. And sometimes diet and exercise can help to prevent that.
So you're speaking of diet and exercise, and when you speak of treatments, is this the treatments that you recommend, I guess, or is it individually based, I'm sure?
It would be individually based, and depending on how far along the diabetic scale we are. If you are fully into the diabetic scale where you're considered a diabetic patient, we would certainly implement some prescription medication to help with that.
Okay. Medicine, diet, exercise.
Yes.
Excellent. And also at Cabrini Hospital, you guys also have a diabetic specialist there as well.
We do. Miss Marie is our diabetic educator, and so for patients that are newly diagnosed with diabetes, or even some that just want a refresher course, we can refer them to her and she can go through some classes with them.
Wonderful. So let's say someone's starting to see the first set of symptoms, extreme thirst and things like that. How would they get in touch with you guys?
We are at Christus Primary Care Alexandria, and they can call us at 528-3200.
Thank you so much. We have more Good Day Sinlaw coming up just after this. We have information on your screen.